Think about an experience that makes you feel good. It could be successfully completing a project at work, eating a warm chocolate chip cookie, or taking a swig of whiskey. It could be a puff of a cigarette or a shopping trip. It might also be a dose of Vicodin or a hit of heroin. These experiences with those highly addictive substances don't automatically lead to addiction. So what makes a particular habit or substance an addiction? What propels some people to seek out these experiences even if they are costly or detrimental to their health and relationships? Addiction, clinically referred to as a biopsychosocial and substance use disorder, is a complex disease of the human brain and the body. It's a combination of your genetics and your neurobiology. That means it's a lot like any other chronic disorder such as type 2 diabetes, cancer, and heart disease. Addiction disrupts regions of the brain that are responsible for reward, motivation, learning, judgment, and memory. That means you can involve in a compulsive use of one or more addictive substances despite any serious health and social consequences. The brain disease model posits that addiction triggers the brain reward system, which arises through transcriptional and epigenetic mechanisms and develops over time from chronically high levels of exposure to an addictive stimulus. Examples of drug and behavior addictions include alcoholism, marijuana addiction, cocaine addiction, heroin addiction, food, chocolate, video game, gambling, and sexual addiction. Today, addiction is understood as a disease that naturally impacts those who are diagnosed and most commonly associated with drug and alcohol abuse. Like diabetes, cancer, and heart disease, addiction is caused by a combination of behavior, psychological, environmental, and biological factors. Genetic risk factors account for about half of the likelihood that an individual will develop addiction. Addiction involves changes in the functioning of the brain and body due to persistent use of nicotine, alcohol, and other substances. The consequences of untreated addiction often include other physical and mental health disorders that require medical attention. If left untreated over time, addiction becomes more severe, disabling, and life-threatening. People feel pleasure when basic needs such as hunger, thirst, and sex are satisfied. In most cases, these feelings of pleasure are caused by the release of certain chemicals in the brain called dopamine, which gives people the feeling of pleasure and reinforce these life-sustaining functions such as eating food and having sex by incentivizing the individual to repeat the behaviors that produce those rewarding feelings. When someone uses addictive substances like heroin, cocaine, alcohol, then they cause the brain to release high levels of these same chemicals that are associated with the natural pleasure or reward. But the problem with the drugs is that they do the job better than natural rewards. Different drugs tap into the dopamine reward system in different ways. Marijuana and heroin have a chemical structure similar to another neurotransmitter and can trick some brain cells into activating neurons that uses dopamine. Cocaine and amphetamines, on the other hand, prolong the effect of dopamine on its target neurons, disrupting normal communication in the brain. Over time, continued release of these chemicals causes a change in the brain system involved in reward, motivation, and memory. The brain tries to get back to a balanced state by minimizing its reaction to those rewarding chemicals like dopamine or releasing stress hormones. As a result, a person may need to use increasing amounts of the substance just to feel closer to normal. The individual may experience intense desires or cravings for the substance and will continue to use it despite harmful or dangerous consequences. Without dopamine creating feelings of pleasure in the brain, individuals also become more sensitive to negative emotions such as stress, anxiety, or depression. These changes in the brain can remain for a long time, even after the person stops using addictive substances. It is believed that these changes may leave those with addiction vulnerable to physical and environmental cues that they associate with substance use, also known as triggers, which can increase their risk for relapse. Some people are more susceptible to these extreme neurobiological changes than others and therefore more susceptible to addiction. Not everyone who tries a cigarette or gets morphine after a surgery becomes addicted to drugs. Similarly, not everyone who gambles becomes addicted to gambling. Many factors influence the development of addictions, from genetics to poor social support networks to the experience of trauma or other co-occurring mental illnesses. One of the biggest risk factors is age. The younger someone is, the more vulnerable they are to addiction. In fact, a federal study from 2014 found that the majority, around 74% of 18 to 13 years old admitted to treatment programs, had started using drugs at age 17 or younger. Several scientific advances have shaped our contemporary understanding of this common and complex problem. For example, brain imaging technology have revealed that our brains respond similarly to different pleasurable experiences. whether derived from ingesting psychoactive substances such as alcohol and other drugs or engaging in behaviors such as gambling, shopping, and sex. Genetic research has revealed that some people are disposed to addiction but not to a specific type of addiction. These findings suggest that the object of addiction is less important than previously believed. Rather, the new thinking reflects the belief that addiction is functional, it serves while it destroys. Addiction is a relationship between a person and an object or activity. With addiction, the object or activity becomes increasingly more important, while previously important activity becomes less important. Ultimately, addiction is about the complex struggle between acting on impulse and resisting that impulse. When this struggle is causing suffering related to health, family, work, and other activities of everyday life, addiction might be involved. Some people think addiction cannot be a disease because it is caused by the individual choice to use substances. While the first use may be by choice, once the brain has been changed by addiction, most experts believe the person loses control of their behavior. Choices does not determine whether something is a disease. Heart disease, diabetes, and some forms of cancer involve personal choice like diet, exercise, sun exposure, etc. A disease is what happens in the body as a result of those choices. Addiction is a chronic and often relapsing disorder. It is often preceded by other emotional problems. Most people who engage in addictive behaviors and go on to develop an actual addiction find that overcoming it is more challenging than they expected. Nevertheless, people can recover from addiction, often on their own. If not on their own, people can recover with the help of their social network or a treatment provider. With the help and support of family, friends, and peers to stay in treatment, they increase their chances of recovery and survival. Usually, recovery from addiction requires many attempts. This can lead to feelings of frustration and helplessness. Smoking is often considered one of the most difficult expressions of addiction to change. Yet, the vast majority of smokers who stop quite on their own. Others stop smoking with the help of professional treatment. It is important to remember that the process of overcoming an addiction often requires many attempts. Each attempt provides an important learning opportunity that changes experience and despite the difficulties, moves recovering people closer to their objectives. There are many pathways into addiction and many routes to recovery. Think about recovery from addiction as a 5-year process that will have its ups and downs. After about 5 years, life can and will be very different. As life becomes more worth living, addiction loses its influence.